Hi, everyone. Welcome to an episode of Orthopod. My name is Mo Bendari. I'm the editor-in-chief. And today I have a sobering discussion, a discussion that's going to help us truly try to understand the healthcare implications and specifically the orthopedic implications of a recent crisis, specifically in Lebanon. I'm here today with Dr. Fadi Zein El-Abidine, who is the chief of orthopedic surgery at Najjar Hospital. And he works currently in Beirut, Lebanon. Welcome, Fadi.
Thank you.
Can you speak maybe just in a brief moment? Can you just give us and our viewers and our members of Ortho Evidence a context to what's just happened? And then maybe we can speak a little bit about to the impact and what you perceive as the ongoing need for healthcare resources, specifically in Beirut.
Yeah, definitely. As you know, it's a big disaster happened, and it's a tragedy seeing all these people dying and injured just in a second. So imagine your hospital with more than 4,000 patients injured and even more, and your emergency were flooded with 300, 500 injured each hospital, and you don't know what to do with all of them. Your team, even at 6 p.m., you know, in the hospital at 6 p.m., the team is not all the team ready. So you have to bring all the medical teams, especially with difficulties that roads are blocked with things flying and from balconies, buildings, on the floor, so yes. It was really difficult to move. So it wasn't easy. So you had to manage with this small team of 2 or 3 residents with one surgeon on call, and with the 100, 200 patients for each hospital. So it was a real disaster. We are not talking about the dead people. And when I say injured, I'm not talking about small shrapnels just going inside the hand. We have hands cut, legs cut. We have the deep wounds, bleeding. We have people coming with their stomach in their hands. People with holding their fingers in the other hand. It was a really tragedy. So it was really a mess having all these patients together. With the small teams, but with after like half an hour, okay, we were with more teams working all together. So what happened? You know, you have stock in the hospital. You have stock for your daily surgeries, your planned surgeries. You know how much you use in the hospital. Like, definitely, you say, okay, I used $200 of this antibiotic. So you keep like 300, but having all these patients all together, they will take all your stock. And definitely one other problem that mainly our stock is present near the port area where the destruction happened. So all the stocks were destroyed. And definitely this is not the only problem, because we had this financial crisis before and the corona problem. So we really had a little stock just like to survive. We were on surviving mode. And then this happened. It was really bad. So we were in shortage of any kind of medication, antibiotics, any products for surgeries, plates, screws, external fixators, all these needed for emergency. And even we lack of supply for suturing, all types of suturing, even the basic ones like staples and everything.
So, I mean, if I just take you just a step back, did you did you personally just know something had happened? Like, when did you, from the moment that you said, okay, something has happened, there was I imagine all through Lebanon, there was almost a shockwave that went through. So something bad had happened. from that point, how much time did you have before you had to really organize the surgical side of things? Because I can't imagine, as you've described, the number of victims coming in, and then you're into a mass casualty scenario. I mean, we often think about it, and I know you've done lots of work with AO Group, and you've done lots of work in spine and trauma. Spine and trauma injuries from ballistics are going to be very common. People are thrown, people are injured. There's going to be all sorts of musculoskeletal injuries. Some are just going to be life-saving, some are going to be limb-saving, and some are just going to be managing open wounds. How much time did you have to organize all this from the moment you knew something terrible had happened?
To be frank with you, what happened is a big explosion in all Beirut. So whether you live in any area in Beirut, you'll think that this explosion happened in your building.
Got it.
So it was really in a second, you see everybody just injured in the street. So it was really just like hell opened its doors. So it's in just 1 second. Everybody was just running to the hospitals. They know there is a hospital here. They were running to the hospitals because all the streets were blocked. So each one was going to his to a nearby hospital. The hospitals in this time, after the explosion, they lost their electricity. So people were entering the hospital on a dark. It was 6 p.m. So it wasn't very dark, because with the at 7 p.m. we have no more lights. So it was really bad. So we have to wait for generators of the hospital to start on. And it was all hospitals have no more glass on them. Just the windows broken, doors broken. So the hospitals were injured. We had to treat the patients from the hospital, inside the hospital. The workers of the hospitals were injured. So it was just like a big problem, a big mess. In just 1 second, you were not waiting for people to come, because you had the injured people inside your hospital.
Right.
So it
right.
really,
You were immediately working. So as chief of orthopedic surgery, I would imagine, Fadi, that as we've talked about, right, injuries are going to be one of the primary issues in those who survive. It's a tragedy at best, but those who survive and get to you, how do you then organize as chief of orthopedics what's going to happen in terms of triaging? Now, I know there are many standard approaches to triaging and mass casualty approaches. Many of us never have to think about it. But when it happens suddenly, even if you have protocols, things go completely out the door, as you can imagine. So I'm just curious, to the extent that you feel like sharing that storyline, what was going through your mind, and how were you thinking about, okay, what do we have to do? How do we prioritize? How are we going to manage with the injured and limited healthcare force right now?
Yeah, we learned during our residency and our medical studies that triage is very important. And like you said, it's easy to learn about, but really when a disaster happened, when you see just a man holding his kid coming, running to you, and he's fighting for his son, maybe it's a small injury and you have bigger injuries, and then as a parent he's away of his mind, he's not thinking. So you need at this time social and more tough triages, just like you have to be tough with them. Just okay, there's someone more injured than you and someone need our care. People are dying, people are bleeding, some people will die if we don't stop their bleeding. Even your son is younger, but definitely there are responsibilities here, and you have to help everybody. But we had to divide between surgeons and residents to take the less injured victims, and maybe nurses for just like cleaning injuries and triaging and this.
Did you have at any point have healthcare providers leaving the hospital environment and heading into the streets and trying to help directly on the streets? I would imagine that because there's so much injury on the streets, Who's helping
That-
with that, or were families just bringing people in? Like, I mean, the hospital would get inundated very quickly. And I would imagine that you would be completely overwhelmed very, very quickly, outside of the overt chaos that is, in any horrible crisis, such as an explosion.
Definitely, we have a Red Cross team very, very active in Beirut, and they were really helpful to come and help some people on the streets. So their team were just like everywhere in Beirut streets. And civil defense, we have this too in Beirut, like Red Cross. So we had many teams working on the streets. And the hospital teams were working just in hospitals. We were divided between surgeons in operating rooms and residents in emergency rooms to do the small minor surgeries, and nurses for cleaning wounds and triaging, if I say so.
So now it's been a very short period of time. I imagine there's still more casualties being uncovered and still more work happening, and people still now coming in. What's the current healthcare capacity right now for you? Like, so now, since some of the immediate crisis element, and I'm not undermining the fact that you're not in an ongoing crisis, but what's happening now that you've had some hours, of trying to save those who can be saved and help those who can be helped?
So what's happening now? After helping many people, some people had less injuries or just like minor injuries, so they preferred to stay at home and avoid going on the streets, which were totally blocked. And they said, okay, it's a minor trauma, it's a bone contusion, it's something hit my back, my neck. So these patients came today. So they came today, and for less emergency cases, but we were still seeing patients with some people having cut tendons and small wounds. We were continuing these surgeries, and but less than yesterday. It's not like hell of yesterday.
Right. And so what does the future hold? And I mean, by future, we're not looking at months, we're looking at the next few days.
No,
I mean, what,
days.
Yeah. So what for you is you said that there was a shortage of all kinds of equipment, all kinds of basic fundamental things. Are there plans, or are there situations now where you get access to that? Or is there anything that is lacking right now that you need urgently? And that hopefully other groups and other people who might see this can be, working very carefully and very fast to get you that information or to get you that equipment you need.
Definitely. I will tell you from two perspectives. As orthopedic surgeon, we need this plate and screws, and we need external fixators, and we need sutures, and these are really mandatory and needed, because if you want to make an order now for any company to bring you, it will take definitely minimum 2 weeks or 3 weeks. And we got some help like on the other side from Kuwait today, but it was just like the basics, like betadine and some gauze, and these we needed them, because definitely we used tons and tons of these products yesterday.
Got it. And so there's no shortage of broader needs outside of orthopedics. I imagine there's even just basic needs that need to be sorted out as well. Do you know what those are?
Yes, medication, antibiotic. And the big disaster was in the cancer. The whole cancer center was destroyed in near the port area. So no more cancer medication. So it's a big disaster here.
Wow. Okay. So there's lots of opportunity for the world to come together here and do whatever we can to try to support and help you. How about human power, human beings, human healthcare workers? How's the health of the system with respect to being able to continue to help those in need? I know you said many were injured themselves.
Definitely. In Lebanon, we have let's say, big manpower. We have a lot of doctors, we have a lot of nurses. We are not in shortage, if you want, in this. But definitely, after seeing now the injuries and what we are, we were treating like basic treatments.
Yeah.
The ABC need. But definitely now with time, we will see more patients having amputations. We need this orthosis. They will have no legs, no arms. We need these too, because these are not emergency cases, but they are needed cases to treat.
I almost think of it sort of, to pardon the expression, but this is the second wave of healthcare resources that will be required, which will be the sequelae of that primary trauma care.
Definitely
that
true.
is going to be required. On that point, you mentioned a couple of times that already, Lebanon has been going through, as the world has, with respect to an economic crisis. COVID has not certainly gone away, and we've been all trying to hopefully, expect for either a vaccine or a treatment, but ultimately we've been all, feeling it to varying degrees. What has this done, do you feel? Like, what do you think at this point, as you clear from the fog of this crisis, on top of, a global pandemic, on top of the economic challenges already that you've been facing, what does all this mean right now for the next little while? Like, is this just one more challenge that you can overcome, or is this one of those ones that becomes so devastating that it becomes hard to overcome?
Trust me, what I really think and what's happening and what I really feel, that we are losing the capacity to bring the best to our patients. Now I'm not thinking I can bring the best plate and screws from these best good companies. So I have to look to less quality, to less to, let's say, like things I used to do 20 years ago, but I'm not using anymore because of the medicine and the progression and evolution. But now we cannot afford anymore these new technologies because they are very expensive now for us. Because our this economic crisis and plus the COVID problem and plus now what we have. So even if I was giving this opportunity for this modern medicine and modern technologies to some patients that they can afford, let's say less than 5%. Now, even with this, maybe it will become a dream to have this modern technologies.
So it has been a big setback. And I actually think that there's been many, many countries and never in any way to undermine what's happening right now in Lebanon, because this is a tragedy. But we are facing an unprecedented time, and I use that term, sparingly, but it's been used a lot. It's hard to imagine what's been going on. When you think about this, and maybe in closing, Fadi, I might ask you this: what can the orthopedic community do right now? I mean, if you're speaking to your orthopedic friends, your orthopedic colleagues, what is the possibility at this point? What can we do ultimately to support you, as a colleague, support our colleagues and our and healthcare providers in Beirut, and obviously broadly in Lebanon? What can we learn and what can we do right now?
Definitely, we learn a lot, but we learn from our mistakes and from our experience and how to react quickly to these disasters. We put a lot of plans, but really when you are on site with this destruction, it's not the same. But definitely there is something in your mind, that will tell you how to go, which way to go. And this is what happened. And within like 10-15 minutes, we regained to the track and started to the track. For what can you do? Definitely, if you can help us with all materials that we can do to help our patients in acute phases like these plates and external fixators that we still need and and prosthetic replacement later on, and we need this orthosis, what we will need soon in the second wave of when we wake up from this problem. And definitely rehabilitation tools. These patients, all these injured patients will need rehabilitation centers. So we will have this wave, let's say the third wave, it will be with rehabilitation, people seeking rehabilitation centers, and they will not find enough. Okay, you have few good ones to take care of these patients and these victims, but who's gonna support all this number of 4,000 injured and more coming? Every day we have, every hour we have 100, 200 extra patients. So it's really not easy. We have, for let's say, first wave, second wave, and third wave of treatment.
And it seems to me the orthopedic community is a robust one. It's one that, you know, where we have not just orthopedic surgeons, but we have our occupational therapists, our physiotherapists, we have our allied healthcare professions that work together. So, you know, we will do everything we can, Fadi, at OrthoEvidence to share this important message and to do everything we possibly can to connect you and our colleagues and our friends in Lebanon as you go through and work through a very, very difficult time. We feel for you, and obviously we wish we could be there in support. I mean, the hardest thing is, you know, seeing something happen and not being able to, you know, be on the ground to help as much as we possibly can. We will do our best, and I assure you, that your friends around the world are, you know, very, very concerned about the well-being. And when things happen, we come to action, and we will do everything we can. Thank you so much. Thank you so much, Fadi. And again, wishing you all, the team, also at the hospital in Beirut, all the best as you continue to lead and, quite frankly, you know, survive what is a very, very difficult time.